Getting a straighter smile used to mean a mouth full of metal brackets and wires. But what if you could do it with transparent plastic? That is the idea behind clear aligner therapy. It is a method of straightening teeth using a series of custom-made clear plastic trays. Because they are virtually invisible and removable, they offer a discreet way to correct your bite. When the first commercial clear aligners arrived in 1999, they introduced a major shift in how dentists planned a patient's care. Instead of relying only on physical measurements, the process moved into the world of 3D computer simulation. Look at these digital models of an upper and lower jaw. Instead of taking messy physical molds, the treatment begins with a quick digital scan to create a perfect virtual map of your teeth. Using this software, an orthodontist calculates the exact path every single tooth needs to take. They map out the entire journey before the very first plastic tray is ever manufactured. This approach changed orthodontics by making it possible to focus on a patient's lifestyle and appearance without losing the accuracy needed for a healthy smile. To understand how soft plastic can move hard teeth, we have to look at biology. Teeth will only shift safely if a consistent, properly directed pressure is applied to the surrounding gum tissue and bone. Traditional metal braces typically rely on a pushing motion, tightening wires to drag teeth into place. Clear aligners work a bit differently. Each plastic tray is molded just slightly out of alignment with your current bite. When you insert it, the material stretches slightly over the tooth, pulling it toward a new position. You don't just wear one tray. You wear a sequence of them, each designed to move your teeth a tiny fraction of a millimeter. These 4 images show exactly how that mathematical sequence works in the real world. Over successive sets of aligners, you can see the wide gaps between the teeth gradually closing, step by step. By dividing a large correction into dozens of microscopic calculated steps, the plastic trays achieve results using only gentle pressure rather than brute force. But a smooth plastic tray has a physical limitation. Teeth are rounded and slippery. A flat piece of plastic has a hard time gripping a tooth to spin it around or pull it downward. To solve this, orthodontists use something called attachments. These are tiny, tooth-colored bumps made of dental composite that are temporarily bonded to specific teeth. Notice the small gray blocks in this diagram. By adding those bumps, the clear aligner has a solid ledge to grab onto. The red arrows show how the plastic can now apply direct pressure against those specific points to guide the tooth. This gives the orthodontist leverage. With an attachment in place, they can perform difficult maneuvers, like shifting a tooth vertically or adjusting the deep root of the tooth, rather than just tilting the top. Those tiny ledges give the plastic the grip it needs to handle a much wider variety of dental corrections. Even with advanced software and custom grips, clear aligners are not a universal replacement for all traditional braces. They perform best for patients dealing with mild to moderate crowding or closing gaps up to 5 millimeters. They are an excellent option for adults who want to maintain a professional appearance while getting treatment. However, in hands of a skilled professional, they can accomplish a lot. If you look at the upper row of images here, you see severe crowding in a 12-year-old patient. The lower row shows the final, fully aligned result using only clear trays. But there's a ceiling to what plastic can do. If a patient has severe jaw misalignments, major skeletal issues, or requires multiple teeth to be extracted, the heavy lifting of traditional metal braces is usually required. Deciding between clear aligners and metal brackets comes down to the underlying bone structure and the complexity of the bite. Because these trays are completely removable, they come with a significant catch. The treatment only works if you stay dedicated to the plan. Most plans require you to wear the trays for 22 hours every single day. They need to be in your mouth essentially all the time, coming out only when you eat or brush your teeth. If you aren't consistent with wearing your trays, your teeth will slowly drift back. Your next set of trays won't fit right, and your treatment might take much longer than expected. Clear aligners offer the comfort and freedom of avoiding metal hardware, but they shift the responsibility for the final result onto your daily habits. When you're ready to find out which treatment path is right for your smile, professional guidance makes all the difference.